So I'm Dr. Andrew Heyman. I'm on faculty at GW. I helped to start the Integrative Medicine program in 2015, and I have the pleasure of introducing Dr. Tracy Gaudet. I feel like I'm having these flashbacks of, reminders of how long we've all been in the field. And when I was back at University of Michigan in the 90s and remembering Dr. Jonas visiting and saying, wow, what an amazing moment. And then also hearing about this incredible program at University of Arizona with Dr. Gaudet, and my goodness, how we've all sort of moved on. So, it's really a pleasure for me to introduce Tracy after all these years and watching her just explode into a major role in our field and being such a leader. So Dr. Gaudet, in September 2019, Dr. Gaudet began her role as executive director for the Whole Health Institute based in Bentonville, Arkansas. And prior to accepting this position, Dr. Gaudet was the founding executive director of the Veterans Health Administration's National Office of Patient-Centered Care and Cultural Transformation. This office is charged with leading VHA's transformation to whole health, an approach to healthcare that empowers and equips people to take charge of their health and live their life to the fullest. Under her leadership, VA healthcare delivery has been radically re-envisioned and is being implemented nationally. Previous to this, Dr. Gaudet was with Duke University Health System, where she served as the executive director of Duke Integrative Medicine until 2010. And under her leadership, Duke Integrative Medicine created a state-of-the-art healthcare facility dedicated to the transformation of medicine through the exploration, demonstration, and research of new models of patient-centered care. Prior to her work at Duke, Dr. Gaudet was the founding executive director of the University of Arizona program in integrative medicine, leading the design of the country's first comprehensive curriculum in this new field and launching the distant learning fellowship. In addition, Dr. Gaudet co-founded the Consortium of Academic Health Centers for Integrative Medicine. She is board certified in obstetrics and gynecology. She's also a recognized leader in the transformation of healthcare. She speaks nationally in public and professional venues. She was featured on the PBS nationally acclaimed special entitled The New Medicine and named by Shape magazine as one of the 11 women who shaped the world. In July of 2011, Dr. Gaudet was recognized as one of the top 25 women in healthcare in 2011 by Modern Healthcare. In October of 2013, Dr. Gaudet was featured as a game changer in Fortune magazine. She was honored as the 2013 recipient of the Bravewell Leadership Award for significant contributions to advancing the field of medicine. Dr. Gaudet is also the author of Consciously Female, a book on integrative medicine and women's health and body, soul, and baby. So I want to give her a very warm welcome. Thank you so much for joining us today. It's really a privilege to have you here.
Oh, you're awesome. And next time we're going to give you a really micro bio. I'm sorry.
I thought that was the small one.
Well, that's a kind of embarrassing, but thank you so much. And it is really exciting to think and reflect on where we have all been and where we are all going. Let me move my camera a little bit. And I'm guessing you guys are hearing me okay? Or somebody would scream up, right? Scream out. Okay, so let me then, and Wayne, it's always dangerous when you give me more time to talk. Let me make sure this is going to work. I need to go to share. I have Jenny, my assistant here to make sure I'm doing this correctly. So go to screen one, right, Jenny? And go to share. You guys be patient with me. As much life as we have spent in Zoom. Okay. All right. Are you guys seeing the first slide, the title slide, okay? I can't see you all.
We're actually seeing the presenter view.
Do you know how to fix it?
So you need to share the other screen.
Oh, okay. Bear with me. This will take up the extra time that I had. This is why I always need help.
Hold on to display settings. So preventer, yep, and then select that.
How about that?
Beautiful.
Oh, good. Okay, I can't see you all right now, which is fine. But will you speak up if you need to interrupt me, or I won't be able, I'm not visually seeing you guys. So just speak up if you're not hearing or something goes off track. Okay. Okay, great. All right, so I will go ahead, and I appreciate Wayne's conversation with us because Wayne, not surprisingly, you created the big case for a lot of what we're going to talk about in a little bit more depth today. So I also included a pretty comprehensive slide deck so that you all can use that and have access to that. Certainly, please take advantage of that and use anything you'd like. So some of what I put in the deck is really for as a resource, and I'll go pretty quickly through that. So I just wanted to say that I'm really grateful to be a part of the conference. The work being done here is amazing. And that one of the nice things, of course, about the whole COVID world is we can do these kinds of conferences more easily and share them more broadly. So thank you for allowing me to be a part of it. So the concept of this radical redesign that we're all involved in, I wanted to say, I will say very briefly why, because I think that Wayne did a great job of doing that. But the essence of this, Wayne outlined in terms of bottom line is our current system isn't working, to put it bluntly. And again, I don't need to go into the depths of that, but I think we're all on the same page. The world has changed dramatically. And again, Wayne did a beautiful job of talking about that and the impact of COVID. And really the thing that I would share about that is I think it really does emphasize that we need to not only rethink how we do healthcare, but what is healthcare and what is the purpose of healthcare, and then redesign how we deliver it to get different outcomes. So it's a major concept, and we've been working on this for a long time. I think what's different now for us is that, this one of my favorite sayings has always been, you can't have breakthroughs without breakdowns. And now I've modified that to say we can't have major breakthroughs without major breakdowns. And that's what we're in, right? Major breakdowns on many levels of society. And it really does create, in my opinion, a great opportunity for change. So let's seize it. It's never easy. So the definition, and you heard this in my intro, that we're kind of using around whole health. People are using the term a lot, which is great. But I think from our perspective, defining what that means with explicitity is important. So the concept that whole health not only treats disease, but really reorients everything to empower and equip people, all right? Both empower people, and we'll talk more about that, and equip people, another core function of the future health system, in my opinion, and two core functions that we don't currently do very well. We're not designed to do that. So empower and equip people for what purpose? For sake of what? So that people can take charge of their health, their physical, their mental, their spiritual health. For what reason? Not just so they don't have diabetes or hypertension, but so that they can live their most full and most meaningful life. So if you think about that for a moment, and you think about that as the paradigm of health care, that's a radical shift. I mean, that's not how we define healthcare right now. It's not the purpose of healthcare right now. So if we're on board for that, it means a lot of things have to change. Not surprisingly, I like to use the concept of as is to will be. And if we look at the future state, if we buy into that, and I'm certainly committed, and my team here in Bentonville is completely committed, as well as the rest of you all, to driving this transformation, a lot of things shift. The entire focus shifts. Yes, we still need to focus on disease management. That's always critical. But does it have to be the sole focus of the system? Or what happens if we shift and broaden and think about the person, and more than just the person, their purpose? And I'll talk more about that in a moment. I'm not going to read this list because I know this is an audience that's on board with this, but I do think it's helpful to see, this is how we're shifting. We're still going to do the current system, but we have to do it bigger and broader in a different way. Yeah, there's never been a greater need for radical transformation than now. And I don't think I need to say more about that on all levels of society, in my opinion. And when you think about what success looks like, I think the first couple of bullets are probably pretty obvious to most people. I mean, certainly if we're successful, and we'll see an increased well-being, both physical and mental, and that will be measurable, right? We'll see decreases in pain and obesity and depression and chronic conditions, the things that we track. We should be seeing also corollary an increase in self-care, decrease in costs, needless to say. It's interesting on the employee side, if we're really succeeding in this, we're also going to see an increase in employee engagement and productivity. The last two bullets are the ones I wanted to focus on a bit, because I don't know that they're spoken about that often. And really, truly, the increase in person's sense of meaning and purpose, an increase in the sense of connectivity, compassion, and our collective humanity is, in my opinion, really what this is about. And it's kind of like an, oh, by the way, people's conditions will get better and their costs will go down, et cetera. But it's much, much more profound than just the disease side of it. Ultimately, a transformation in social consciousness is what we will see, and with it, a quantum leap in health and well-being. So the core issue, I've spent my whole career in these kinds of conversations and trying to do things differently. And somewhere around, I don't know, maybe 10 years ago, my own personal aha was, oh my gosh, like the fundamental issue is we are starting from the wrong place. And what I mean by that is that we're starting, and again, I mean, I'm an obstetrician gynecologist. I feel like I was always practicing. I certainly tried to always practice in a holistic way, in a compassionate way. And I think by and large, I was doing that. And I was still, however, starting with the chief complaint and the problem list. And I was making a treatment plan for the problem list. And I realized along the way that, wow, like I'm not actually starting, as Wayne said, with the person and who they are. And I think I love to tell stories, and I'll try not to tell too many because it takes a lot of time, but I think stories are important to illustrate this. And probably one of the more poignant stories I would share about this was actually a story shared to me with the director of the VA in Dallas, Texas, and he was sharing the story of a veteran who had committed suicide on their campus. He was an outpatient in the VA there, and he got great clinical care, and his patient-centered care team knew him well, or they thought they did. He was compliant. He had hypertension and diabetes, and his hypertension was well controlled, and his hemoglobin A1C was where it needed to be, and he was seen regularly. And when this gentleman committed suicide, it really sent a shockwave through the primary care team in a big way, because they're compassionate, caring people. They thought they knew him well, and they didn't know he was suffering. And his family said, oh yeah, he's been struggling for a long time just to get through the day. And that pausing to think about that, and the team who first felt personally responsible, of course, we realized, you know what, it's because we're asking the wrong questions. We're starting from the wrong place. We're dealing with the hypertension, the diabetes, the list of problems, and we're addressing the problems, but what about the person? And we missed his suffering. And that's something, hopefully we don't forget. We actually really need to change the conversation. We need to start from a different place. So I wanted to say a bit more about purpose. And as we've done this work, understanding the power of purpose in someone's life has the opportunity to flip the entire system and change the entire intention of healthcare. So what if we actually help people reconnect with a sense of meaning and purpose in their life? What if we change that conversation? And I will share that I often share that my own personal aha around that was when I was still at Duke Integrative Medicine, and a lot of my patients there were cancer patients. And I started realizing that a lot of those cancer patients were telling me, I'm not even asking the question, they were volunteering to me that their cancer diagnosis and the journey they were on was a blessing. And of course, you first hear that and you go, oh my gosh, like cancer is horrific. And it is. And they weren't saying it wasn't horrific. But what they were saying, person after person, unsolicited by me, they were sharing that the cancer diagnosis made them stop their normal day-to-day life and pause and reflect on, wow, the question that Wayne asked, what really matters, like really matters. If I only have days left, or even if I have decades left, what really matters to me? And then realigning whatever time you have around that which really matters. And I was so touched by that. And I just thought, man, let's not wait for the cancer diagnosis, right? What if healthcare was about asking those questions and helping people reflect on those very things in their life and realigning everything behind their purpose? And so I've been kind of obsessed with that. And I think this is a great study. I don't know if you guys have seen this study. It was published in JAMA in 2019. And it's great, right? Because it's basically, there's been a fair amount of evidence saying that we know that a strong sense of purpose in life leads to improvements in physical health and mental health and quality of life. That's been pretty well documented. This is a great study that takes it one level further. It's about 7,000 patients in this study. And this study showed that life purpose is actually significantly associated with all-cause mortality. So, and in a kind of a dose response curve is what you can see on that slide. And the reference is there if you want to pull the article. So I love that. I love it. It's like, great, evidence, purpose really matters in a very significant way. It's linked to mortality. And that's great to know. So we should be paying more attention to purpose. But the real question I have is, what is the opportunity if we not only help people focus more on their purpose, but we then link purpose, that own person's sense of meaning and purpose, as the driver of their healthcare? What if that becomes the foundation of their healthcare? So everybody on the team, anybody associated with that person, is fully aware of that person's purpose. And I want to say a little moment about this. I have gotten sometimes some, in my opinion, kind of obnoxious feedback on that, saying, well, that's fine for, educated, people who, they think about Maslow's triangle and they think, oh, if you have all your needs met, you can have the privilege of thinking about purpose. And I want to say wrong. I mean, some of the most grounded people I know in purpose have been people that I've known and loved in Haiti, in the poorest country in the Western Hemisphere, who are absolutely grounded. They don't know where their next meal is coming from, and they really may not survive, but they are grounded in a sense of meaning and purpose in their life. And the same is true when we worked with our veteran population and the homeless population. So this is not, a hoity-toity concept. This is like, what brings you a sense of joy? And what is your sense of meaning and purpose? And that, if you're a human being, that's a pertinent question, right? So if we actually link your healthcare to that sense of purpose, so that your healthcare is actually in service of your sense of purpose, that's really profound. And even though it's really profound, I would say it's not enough, right? You can have, I think, exploring a sense of purpose allows people to become intrinsically motivated about their health and their self-care. So that's huge, because the intrinsic motivation is absolutely critical. And we know that just pounding people with data that, oh, smoking causes cancer, or you should lose weight, we all know that. There's this huge gap between knowledge and behavior, and more facts and knowledge does not bridge that gap, right? What bridges the gap is intrinsic motivation, wanting to take on your life, wanting to take on your health. So, but it's not enough. And what do I mean by that? If you don't also have the new skills to address your self-care, if you've only ever eaten one way your whole life or managed your stress one way your whole life, it's not enough, right? So, but if you think about coupling a strong sense of purpose, having that be the foundation of your self-care and your healthcare, and then coupling that with people supporting you and learning new skills and incorporating new skills in your life day to day, now we have a chance to really see magic and hope return. And I will say that that's the theme I keep seeing, is hope. So this is an evolved model. If you've seen, this started at Duke, and everybody's got their models. And then we, again, evolved that in the VA, and now in the Whole Health Institute, we have evolved that a little further. And the biggest thing I would say that has evolved is the center. I mean, we said, let's say what we mean, my purpose. Let's put that in the center of this paradigm. It starts there. That's where we're changing the conversation. And of course you can see, and not surprising to anybody in this audience, that the skill of mindfulness, which we're now terming and what it actually is, pause, notice, and make a conscious choice, is important for all areas of self-care. Self-care is the biggest piece of this model, right? We know that. That's really what matters most. Combined with care, with good health care, in the context of our communities equals whole health. So that's our paradigm. And I have a couple slides that dive a little bit more in depth on that. I'll get to in a second. So I wanted to just say, when I have reflected on what's really different about whole health, these are just my reflections. I think there's 5 key distinctions, and there's 1,000 ways to split these up. But in the way my mind works, the first is the one I spent most of our time so far talking about, right? Changing the conversation and starting from a different place, starting from that exploration of meaning or aspiration or purpose. The second key distinction, in my opinion, is helping people understand that their self-reflection and their self-awareness of how their body is, how their mind is, making that conscious, that there's a tremendous amount of wisdom in there. And that, yes, the physicians and healthcare teams have a lot to add, but they are not the experts on you, right? So this concept, it's a real shift to say, no, you pause and reflect, and your own self-awareness, in these areas of self-care is absolutely essential and needs to lead the way. That's a shift. The concept of holism, I think this is funny, right? I think the way to think about it is, as physicians and other healthcare providers, we're trained to look at the risk factors and what's the greatest risk factor. Oh, you're a smoker. I'll pick on smoking for a second. Well, let's make that your number one priority, because that's, the biggest barrier to your health and well-being, perhaps. And perhaps logically that's true. But one of the things that's different about this approach is to go where the water is flowing, one of my friends always said, meaning if somebody knows that they are not going, I'll give you another quick story. There was, actually it's the same Dallas VA, the facility director there told me another great story about this guy. He's like, oh my gosh, he's the facility director, and he's kind of a small guy in stature, the facility director. And he tells a story about a very large, strong, angry veteran demanding to see him, coming into his office, pounding on his table and saying, if one more person tells me to stop smoking, I will never come back. And then he went on to say, with tears, that there are many days where that cigarette is the only thing between him and pulling the trigger on himself. And to not be known and to not be seen as the person he was, struggling with what he was, and somebody, and I'm sure trying to do the best they could, saying, oh, you're a smoker. It says here I should ask you about your smoking and encourage you to quit. Doesn't work, right? And actually risks alienating that person. So the concept of going where people have energy and interest to go, rather than just the linear top down, you should lose weight, you should, stop smoking, is a big shift compared to the way I was trained anyway. The fourth of these is the innate capacity to heal. And everybody again on this line, I'm sure, sees it that way, but to recognize that that's not the paradigm of the medical model. Obviously, the medical model is find the problem and fix it. It's a war. That's why we use language around, everything's an anti. We have an antibiotic, an antihypertensive, an antipsychotic, because our paradigm is, here's the enemy and we're going to go to war and fight it. Very different paradigm to say, actually, the body and the mind have innate capacities to heal. They're not limitless. It's not like if you do it all right, you never get sick or you never die. But, and we have seen this in COVID, right? We've seen this a lot, that if your intrinsic capacity to heal is as resilient and strong as it can be, the things you're at risk for are less likely to happen or less likely to be severe. So it's a flip in the way we think about approaching health and well-being and disease management. And lastly, the fifth one, in my opinion, is actually the power of experience. And the reason I want to emphasize that is that creates the passion. We can talk about this all we want, but unless you or your people or your employees have a personal experience of whole health, nothing else matters. The rest is just concepts, and it's not going to get you where you want to go. So from my vantage point, this is the way I think about what makes whole health and this approach so dramatically different. Okay, so having said that, the question is, okay, all right, let's just say we're up for that. How the heck do you design a system to do that? And I will reference a lot of the VA work in this section because I feel like the VA has done about 8 years of very intensive R&D on this very question, having been the big health system. And the VA said, we want to do this. So let's figure out how the heck do we do it, okay? So you may, if you've heard me speak, you've seen this this little visual also, the transformed health system. And what you'll notice about this is the treat circle is one part of the model. The clinical care is still a very important piece of this transformed system, but it is not the centerpiece any longer. And I think right now, if we were honest and we were drawing this diagram to say what's the current state, the clinical care treat piece would be most of the system. So in this vision, this concept of empowerment and equipping, well, again, how do we address empowering? This is exploring what matters most, the mission, and what we've learned through 8 years of trial and error and study is that that's actually really best done, not in the clinical visit and not by clinicians, surprise, surprise, but by peers who are trained to engage each other in that kind of a conversation. And that is amazingly powerful. And guess what? It's also more scalable, right? It doesn't have to be bottlenecked by clinicians. And as we said, it's not in and of itself not enough. So the equip piece of this model, this self-care emphasis, is where the focus is on skill building and support in combination with a clinical team that's aligned and trained in this way too. This slide just gives a little bit more details about each of what's in each of those buckets as we've evolved it. It's going to keep evolving and get better and better, I know. But the cool thing is this is not just a concept. This has been really well fleshed out, well developed, and well studied. And so we have, proof of concept upon which to build. So I just include a lot of these slides that I'm going to go into, I included for your reference, and I'll go pretty quickly through them. Not surprising, and also Wayne had a similar slide to this. The team is different. It's not just the current team, and I know I oversimplify the current team, but to say, the peers, in my opinion, these whole health partners are a game changer. And maybe those are community health workers who are trained in this approach. But the concept of peers from the community trained to do this part of the model is absolutely a game changer. And then a lot of the integrative health professions that we know, including coaches and nutrition and yoga and acupuncture, et cetera, now working in a system that's actually designed to allow them to do their thing, right? As opposed to trying to paste it on the outside of the current paradigm, which isn't designed to actually empower it. This is a very, very different model. So this is a drill down on each of these pieces. And again, I really wanted you to have this as a resource. So I will go pretty quickly through this because then I want to have a fair amount of time to talk about the Whole Health Institute. And lots of people have been asking me to say more about that. So if you think back to the visual that we used for the individual person, starting with their purpose, plus their self-care, plus their care team in the communities equals whole health, how does the system of delivery match up to that? Okay, so it's probably pretty obvious, right? My purpose is really in that is the empower piece, finding your purpose led by peers, as we said. The self-care is the equipping, new skill building and new support. How do you just learn new ways of eating or managing your stress or moving your body? How do you learn those skills to do it? And then how do you have the support? So these are actually well-being centers, right? This can happen in the community. This can happen in my mind. We have a vision where the future state is that the center of healthcare is not actually the clinic, but is actually well-being centers where you're exploring your purpose and having support and skill building to address your self-care. And then you go to the clinic when you need to. The care team, absolutely. To have this aligned and empowered by clinicians who are trained in this way, who do the clinical work in the context of whole health, is absolutely essential. And of course, communities is where we all live, right? So if we're addressing health and well-being only in the clinic or even in on the well-being center, and it's not pervasive in your community, it's not going to succeed. All right, so does it work? I think Wayne alluded to the fact that I might be referencing some of the outcomes with the VA. Because it's great data and you guys can use it. And I have the reference in here because it definitely makes the case of, is this a viable approach and does it have effectiveness? First, I wanted to start with individual voices. And these are 3 voices from 3 people on one visit that I made to one whole health group. And I wanted to say that because this isn't like cherry picked quotes from, you know, hundreds of people and we got picked the best. This was a group of about 12 folks who were in a whole health group led by peers. And, you know, I think I always think I'm not going to read these because you can read them, but I think it's important to have the voice of people in the room, the Zoom room. So I think, I think these quotes are actually really telling. So for example, the first one, right? Whole health began my journey to joy. So I love that, right? It wasn't about my hypertension. It was about my journey to joy. I am a changed person. This is a 52-year-old guy. I no longer need my cane. So guess what? There are real outcomes, right? The whole health group has become my family. It's about relationship, support. My neurologist said he doesn't need to see me anymore. So guess what? Reduction in costs and improvement in clinical outcomes. But hear the story, right? The next gentleman is a 71-year-old guy. I think he's so cool. I love this. Wait, you'll get to my favorite part in this quote. I have lost 33 pounds. I go to FIT class, which is a movement exercise class, a nutrition class, battlefield or auricular acupuncture, and regular acupuncture. Here's the line. My wife says I have a positive attitude now. I love it so much, right? Oh, and by the way, my diabetes is under control. My blood pressure is down, my lipids are good. I see my primary care doctor much less, right? So you hear it in their stories. It's about their life. And oh, by the way, their conditions are better too. And then a very poignant one, a 37-year-old woman. I used to drive over the Mississippi River Bridge to the Jefferson Barracks VA and think about jumping every time. The whole health system has helped me explore my purpose, find ways to use nutrition to reduce my pain, and use iRest and Tai Chi to get moving again. Now I drive over that bridge and I think about tomorrow. I have hope. And I want to say that the theme that I have heard over and over and over again in conversations with people engaged in this whole health is hope. That's what I hear. They have hope again. And you know, when there's hope, needless to say, there's so much that's possible. So I promised to talk about the VA journey, and I wanted to, I put this timeline up just to give folks context for how this has come to be. And I won't go through every one of these bullets, but the essence of it is, you know, we, like the rest of the nation, had a vision for, yeah, we got to change this. This is doing more of the same is not success. So we all share a vision of, you know, greater health, well-being, integrative approaches, holistic philosophies. I mean, this wasn't new, but we didn't know how to create the system to deliver that. So the focus of the VA work was, well, what does it look like to create a system? And we started with broad think tank with national thought leaders. And then we created 8 centers of innovation. These were facilities who said, we don't know what we're doing, but we're going to sign up and try and dump in, and we're going to learn. We had over 200 grants of folks in the field who were doing aspects that looked really innovative. And we said, we don't know, maybe there's hope there. Maybe there's something there. We're going to fund that and we're going to learn from that. You know, from that, we went on to 25 sites. Once we started to get our hands around some of the core elements of this approach, 25 sites that were design sites, and they further evolved this approach. And then we aligned this with both opioid safety, suicide prevention, and employee health. So people started to understand, oh, this isn't like a program that sits over there. This is an approach that can impact all of these things, and most certainly including opioid safety, suicide, and employee health. And, there's a big breakthrough in 2017 because we were actually successful in getting whole health and complementary integrative health services included in the medical benefits package for veterans. So that was, and we also realigned the reimbursement system so that the facilities would get reimbursed for that. So this is, of course, if we don't align the incentives behind this model, it doesn't matter how great the model is, transformation won't happen. So those were big turning points, I think, for the work. And then we launched 18 health systems that were fully funded, one in every network or VISN, if you're familiar with the VA world, that was called a flagship site. And those facilities were funded to launch all three pieces of the system: empower, equip, and treat. And they had support from the office for training and implementation. And we also had the opportunity to do real great research across those 18 facilities. In addition to that, there were over 140 facilities who were implementing aspects of whole health, but the 18 were funded and supported to do the whole enchilada of this now designed system to see, does it really work? I will just say that I'm going to give you some of the outcomes from those 18 in the first 2 years of the research. But I'm excited because the VA went on in 2020 to fund another 36 sites. So there's now 55 facilities funded and implementing the whole system. So it's a pretty grand experiment and pretty awesome. This is James Marzolf's data, who now works with us in the Whole Health Institute. And not to go into the details, but I wanted to show this particular slide because this is the alumni. This is the alumni. So what that means is a cohort of veterans who were no longer actively using whole health services. They had been, and then for 12 months they weren't. And what was really cool is that we saw costs decrease when people were active, but what's really exciting is to see the continued cost decrease, which we're presuming means that self-care that they were taught stuck, and they actually have changed how they're living their life. So to me, this is really exciting, a really exciting indicator. The next set of slides, which I will just hit the highlights on and then give you the rest, is the formal research evaluation across these 18 systems. And Ben Kligler, who I know you all know, who's now the head of the Office of Patient-Centered Care and Cultural Transformation for VA, is the lead on all of this and can certainly answer any questions. I did want to list out, when I said that we were successful in getting coverage, medical benefits coverage for whole health and complementary integrative health services, this list of services is what ended up included in the medical benefits package. So a big deal. And of course, it wasn't like, oh, if you want, get a massage and we'll cover it. It was clinically indicated, but these things are now mandated to be covered, which is a big deal. 31%, is it working? Okay, sorry. 31% of veterans with chronic pain across these 18 sites were opting to use whole health. And I'm going to hit the highlights of these. The impact was great. When you looked at whole health participants compared to non, 3-fold reduction in opioid use with patients with chronic pain. We also found, if you look at this bottom set of bullets, I love this. Perceptions of care were perceived as being more patient-centered. The veterans in whole health had increased engagement in their healthcare. They also had increased engagement in their self-care. And the one I like the most, because to me it indicates that we're getting somewhere with senses of meaning and purpose, they had increased engagement in their life. And again, if you agree with the paradigm that the purpose and the driver of healthcare becomes your life and your sense of meaning and purpose, that's really cool to see. That makes me really happy. This is just the graphic on the opioid utilization. And I think it is interesting to see that it does look like there's a dose response curve of some sort, right? That the more comprehensive, the intensive and comprehensive program was where we saw the greatest impact on opioid use. On the employee side, so this is a research team that was looking at the effect or impact on employees in the whole health system compared to employees in the usual VA system. And the bottom line is it had a great impact. And I won't read all the specifics, but the key things are lower voluntary turnover, so less resignations, less burnout, greater motivation in the people who were involved in whole health, the employees who were involved in whole health. The facilities overall also had higher ratings on overall hospital performance and higher ratings on patient-centered care. This is the graphic on the resignation rates. So you see it's across not only physicians and nurses, but all health service employees. So that's pretty exciting. If you look at costs, there was a significant decrease in costs for veterans with mental health conditions and also veterans with chronic conditions. And essentially, they still had an increase, a small increase in their pharmaceutical expenses, but look at it compared to the non-whole health group. So 3.5% increase compared to 12.5% in the non-whole health group, and 4.3 compared to 15.8. Again, please know you'll have these slides, and then this is the paper. This is the reference to the paper, so you can get all the details that you want. But I'm grateful to the VA and the amazing people there and the amazing veterans and the work that they have done to really flesh out this approach and get us real data in a system that is big enough for us to be able to do that. Okay, in the last little bit of time I had, people have asked a lot of questions to me about, all right, well, you left the VA. Why'd you leave the VA? And I'll tell you, I didn't want to leave the VA. I wasn't planning on leaving the VA because I love the VA and the work isn't quite done. But I had a great team there and they are carrying it on. And Ben's an amazing leader. But the real reason I left was because of this new opportunity. And that is the opportunity to create the Whole Health Institute. And as you heard in my intro, we are based in Bentonville, Arkansas. And the mission of the Institute, we already defined what whole health is: empowering and equipping people to take charge of their health, all aspects, to live a full and meaningful life. Well, the mission of the Institute is to make whole health available to all people in all communities. And I know that's like a very broad, amazingly big vision. And the reason that I think the time is right for that is not because of what we're going to do or what we can do, but because of what everybody else is doing. And what I mean by that, so many of us, like we were talking about in my intro, like for 20, 25 years, we've been on this journey and great work is happening. There has been great advances in the transformation of different aspects of healthcare, how we deliver healthcare, how we pay for it, how we educate, as a few examples. Lots of progress, but the big system, the big transformation hasn't happened yet. And why is that? In my opinion, it's largely because we haven't integrated across those silos. And I think prior to now, we probably weren't ready to integrate across those silos because the transformation work within those areas needed to be developed more. But I really believe that we are now at close to a tipping point. And if the Institute can help bridge these different systems that are trying to drive transformation and integrate and align them, now we have a chance to really flip it all. So that's the concept for the Institute. I use this kind of reflection of our outward work as well as our inward work. But if you look at kind of the outward work, because we don't need another institute to do what others are already doing beautifully and well. So, we're not recreating what you guys are already doing. But what I do think that the Institute can contribute that isn't currently present and available is to have this goal of transforming what I call a system of systems. So by bringing resources and efforts together across different transformational efforts, I think we can take this to another level. That means we're going to have unprecedented public-private partnerships and collaborations with people making progress. It's all about the collaborations. We can convene and catalyze thought leaders as another strategy and way to make this happen, while always paying attention to what I call living laboratories, just like we did in the VA. How does it actually work? What doesn't work? The answers are going to come from the grassroots strategies, and they will inform the rest of our work. So those things in terms of what makes us different in an outwardly facing way is how I think about it and how I conceive of it. So we thought about what are these systems? What are the systems that have to be transformed if this vision that we're all sharing is actually going to come to fruition? So this is our list of 13. I'm sure they're not complete. And if you guys, I would love to hear your thoughts about what's missing. There's lots of ways to dice it up, but the 13 that we list, I'm not going to read them. Not to say that the Whole Health Institute is going to drive change in all of those, but to say, you know what, all of these systems are players. And if, for example, we redefine how we deliver healthcare, but we don't redefine how we pay for it to align, it's going to fail, right? Or if we don't align how we educate people in the health system, it's going to fail. So I don't need to go through all that logic with you guys, but these are the 13 systems that we have identified. The ones that are highlighted are the ones that we are first focusing on. And I was hired about 1.5 years ago. So we have teams, small teams, mighty teams, and leadership in the areas of community whole health, health system delivery, medical schools and professional education, health sector finance and policy, and employers. And we're now adding food and nutrition this year. So those are the ones we've highlighted, primarily because we feel as though that's a place where we have some expertise and there's an opportunity to make a big impact pretty quickly. So that's kind of our logic there. I included this slide, and this is probably going to evolve over time, but as far as the Whole Health Institute is concerned, we do think there are efforts where we will hopefully help lead change because we have some expertise, it's important, and there's a great opportunity, and you can see those across the top. Then I think there are strategies or systems where we will help generate change, but not as much lead it as generate it, because there's a lot, for example, food and nutrition, tons of efforts going on about how do we improve food and nutrition and availability in agriculture. So we don't need to start that, but we do need to partner. And then big systems like big pharma and biotech and government, et cetera, where I think we are hoping to create change by catalyzing. So, and over time, these may change. We may take one out of one level and move it to a different one, but that's how we're conceiving of it at this point in time. I will say in the experience in education, you may have heard that we are starting a brand new whole health school of medicine and health sciences, which is a big undertaking in and of itself. That came about because the region here made a decision that they really needed a new school of medicine. And therefore, the Institute felt, well, if there's going to be a new school of medicine, let's not miss that opportunity to do it from the ground up in a radically different way. So that is what we're up to. The concept is not just a school of medicine, but the reason we say whole health school of medicine and health sciences is an opportunity to train the entire whole health team, like we've been talking about, together. A new definition of team-based learning, right? So stay tuned on that. We're hoping to matriculate our first class in 2024. So in closing, I wanted to just say, I always like to think about how we can fail. To me, it feels important for us to pay attention always to the likely places we can fail so that we're on alert. So I think we can certainly fail if we don't recognize this as multiple large system transformations. We can fail if we have only a focus from the top and we don't build it from the grassroots. We have to be informed continuously of how is it really in the communities, in the employer's workplace, et cetera. If we don't constantly expand and innovate our repertoire of approaches to well-being, we can fail if we don't align the resources and the measurements with desired outcomes. We've got to change that. If we continue to measure and value like fee-for-service kinds of things, episodic events, or transactions as if that's success, will fail. So if we don't use and value measures of lifelong health and well-being, we'll fail. So a lot of ways we can fail, but I think this is all on our radar screen. I bet none of these are surprising to any of us on this conference. So we need to just pay attention to it. So I asked myself, what would it be if I painted a picture of the future state? So this was what I came up with. So, imagine a day when the job of healthcare is to help people explore their sense of meaning and purpose and live their fullest life. If that really was the purpose of healthcare. Imagine a day when systems are reimbursed for improving well-being. When community whole health centers, where people have support and skill building, when that is the core of healthcare and the clinics and the hospitals are used as needed. When there are peer groups, whole health peer groups in every community and available to all people to just drop in. I think of it kind of like an AA thing, right? Like what if everywhere you go, you know there's going to be a whole health peer group and you can drop in anytime you want. When whole health is integrated across neighborhoods, across schools, and across workplaces. When this is Henri Roca's idea, when there is a designated whole health champion in every family. And then we get to the deeper stuff. When people's sense of meaning and purpose, connectivity, compassion, and collective humanity is profound. Imagine that this transformation in social consciousness results in a quantum leap in health and well-being. So that is my beautiful picture, my vision, shared by others I know. And I would like to, and if you guys have heard me talk, you've probably seen this 3-minute video because it's my favorite video in the world. I would encourage you, if you don't mind, to not say, oh, I've seen it and tune out. Every single time I've seen this video, and I see it all the time, I see something new. So what I'd like you to know about this before we try to run it, Jenny's in here to help me make sure it runs, is it's a true story. It happened to be, get the attention of a bank, and the bank wanted to share the story. So they made this video about it. So it's a true story. And the other thing you need to know is it's in subtitles. So you need to pay really close attention. And let's see, can you come and help me? All right, let's see if we can make this happen. So do I click on this? Here, I'm going to let you do it. I need a lot of help. And then I'll expand it. Is that working? Should have volume already.
Well, you didn't post it.
Yeah, but we should have there.
So we aren't hearing anything yet. Did you share sound when you shared this? It's a little box you have to click on the left-hand side of the share screen.
All right, let's see.
I've made this mistake myself, which is why I know. Although now I hear it. We hear it now.
Is it loud enough though?
Maybe there's no sound at the beginning.
Yeah, there's just clicks at the beginning.
Oh, I can hear that.
人为什么活着？
I think it's good.
为了思念，为了活下去，为了活更长，还是为了离开？ 去骑摩托车吧！5个台湾人，平均年龄81岁，1个重听，1个得了癌症。 3个有心脏病，每一个都有退化性关节炎。6个月的准备，环岛13天。 1139公里，从北到南，从黑夜到白天，只为了一个简单的理由。 5 什么要活着。
All right, did that work?
Yes, it was fantastic, even though I've seen it before.
I know, I've seen it so many times, you guys, and I just, I'm touched by it every time because it really, I'll pause that, I don't know. I think it just brings to life what we've been talking about, right? Like, yeah, you have cancer and heart disease and, you know, atherosclerosis, and are you going to sit around a table and wait to die? You know, are you going to actually think, what do you live for? So thank you so much for the opportunity to be a part of the conference. And I did take advantage of a little bit of that time Wayne gave me.